Welcome to Eye Contact. I'm Richard Packard, and today we're talking to Dr. Nic Reus about optimizing machine settings for all Phaco cases. So welcome, Nic.
Thank you.
Do you believe it's important to have both peristaltic and Venturi pump technology available in your Phaco system, or can you just rely on one of them for all cases?
Well, I have to say that I only rely on peristaltic pump. I use the Centurion system, which has the peristaltic pump. For my cases, it's okay to have just the peristaltic pump. A Venturi system can be helpful for, you can reach a higher followability in your, during your Phaco emulsification. So you speed up the operation. But nowadays with the modern peristaltic pumps, the speeds are such that the difference between, I think, peristaltic pumps and Venturi pumps are not that big as they used to be. For more difficult cases, where you need a very stable anterior chamber, low flow settings, then I think peristaltic pumps are better for your more difficult cases.
Do you ever, on the Centurion, go for what I would call Venturi emulation settings by having a linear vacuum or linear flow to give you greater control of what you're doing?
I hardly use that. I've been taught by Chia using low flow dynamics, so I have to say that I generally use low flows. But I have colleagues in my practice who do use high flow rates, and with that you can mimic your Venturi settings, and they like to have the immediate followability that you stay with your Phaco tip in the center of the eye, and all the fragments, they fly towards your tip and take out the lens very quickly.
That you like to have a slower approach to?
I do. I have to say, I have several standard cases that I do during my surgery days, but I have a lot of more complex cases. And for these complex cases, I think it's much better to have a bit of a more slow system, which is efficient. And my average case takes about 6-7 minutes in operation time. So it's not really slow, but it's more quiet and more peaceful to operate like that.
And you say that you do more complex cases. Do you actually vary your settings for different cataract densities, or do you not feel the need to do that?
I would say I hardly change my settings in my Phaco machine. If I have a very hard cataract, I do change, going from divide and conquer technique to a chopping technique, either horizontal technique or horizontal chopping, or with the more luminescence rubra cataracts, I go to a vertical chopping. So I change that technique, but often I use my normal settings. Although with more rubra cataract, I sometimes increase my amplitude, the power of my phacoemulsification.
And do you only do that with your torsional setting, or do you add any longitudinal at all?
No, I don't. For quadrant removal, I don't use any longitudinal.
But what
phaco.
about with a dense cataract?
No, I don't. No. With the dense cataracts, I think with torsional phaco, if you have very small fragments and you allow them to rotate freely around the tip, I don't think you need longitudinal phaco that much, because your nucleus, your fragment, is rotating around your tip, and it gets shaved very efficiently. I do have to say that I use a pulse setting for my phacoemulsification in quadrant removal, so that it gives time for the fragment to reorient at the tip, so as to shave it more efficiently.
And what pulse setting do you using? How many milliseconds on and how many milliseconds off?
That's a good question. I have a very terrible memory with numbers. Okay. So I would have to look that up, and maybe we can put that in the comments.
Okay, well, we've done hard cataracts. Do you do anything special for soft cataracts? Because they can in many ways be more challenging.
Well, the technique of attacking a soft lens is very different, because you're not able to chop or do a divide and conquer technique. So what I do is do a hydrodissection and a hydrodelineation, and then use my aspiration flow to take out the lens and get rid of it. In my settings, I do not have a big difference between a quadrant removal and epinucleus removal. My amplitude for my phaco power in epinucleus removal is a bit lower, but often these lenses, these soft lenses, you can to take them out with foot pedal position 2, just aspiration, and you don't need any ultrasound.
No, indeed. I mean, that's one of the advantages. The most important thing, as you know, is just really to break the edge of the nucleus so that you can get something coming towards you.
Yes.
What about with other comorbidities like pseudo exfoliation or small pupils or IFIS? I mean, do you feel that you need to change your settings for any of these, or do you again use your standard settings throughout?
Well, for many cases, I think with people who use alpha-1 antagonists, that because the flow with this Centurion system is relatively low, the iris doesn't get excited too much, and the risk for an IFIS developing isn't that high. But if you do get an IFIS, I tend to lower my aspiration flow rate to about 14 millimeters per minute, because it tends to ease the flow in the anterior chamber and get a more restful iris. Similar for pseudo exfoliation with the risk of zonulolysis, I tend to lower my aspiration flow rate, not to tear too much on my lens and then on my zonular fibers.
Now, I know that you use the Centurion Phaco, and one of the advantages potentially of this machine is the ability for the surgeon to set the intraocular pressure that they wish to use throughout the procedure. Where do you put yours, and why do you do that?
I use an intraocular pressure of 36 millimeters of mercury. I like that setting. Many colleagues do them higher. Many people start at 55 and then go to 50 or 40. I'm at 36 now. It gives me a very stable anterior chamber with these settings. And I do have the impression that the cornea is clearer at the end of surgery with a lower amount of your bottle height. Plus, in people with advanced glaucoma or people who had a thrombosis in their eye, I think it's important to have your eye pressure as low as possible. And if you do that as a standard setting, use your eye pressure very low, you don't have to use a different setting in these very difficult cases. I'm already using the lower settings. So then it's easier to perform these more difficult cases because you use your standard settings.
When you started using these low IOP settings, which are obviously much lower than you would have been using on the Infinity, did you feel that you had to make any change with the way you actually moved your instruments in the eye because of the softness of it?
Yes, that's exactly what you noticed, that the eye is much softer. And the thing is that you have the idea that you operate under high pressures with the Infinity, but when you go to Centurion, your eye is softer. So you have to be much more gentle with the eye, which in fact is a good thing.
Yeah.
Because if you aren't gentle, you will distort the eye, which is much worse for your corneal edema and presumably also the pain in the patient, experience pain on the topical anesthesia. So it's much better, I think, because you have to be much more aware of how you use your instruments and keep it steady in the eye and don't put too much pressure on the eye.
Do you work with trainees at all?
Yes, a lot.
Okay.
Yes.
So what sort of settings do you use for trainees in terms of the intraocular pressure?
So for my trainees, I have the same settings as I have, but I increase the intraocular pressure to about 50.
Right.
So that the level of safety is a bit higher for them and for me and for the patient.
Good. Thank you very much indeed. For more information on this and related topics, visit us at eurotimes.org.